Hello and welcome to the 7th lecture in the series of Principles of Exercise Therapy. And this week we're covering biomechanics in physiotherapy. So bio, obviously biology, mechanics, the study, really Newton's laws effectively. So let's go on. So we have our centering slide. What physiotherapy is about. This is our mission statement. It's about human anatomy, physiology. It's about human movement and function. It's about maximizing wellness and potential, minimizing disease and injury, and ultimately solving real-world problems. So by the end of this session, we want you to have a basic understanding of the mechanics, the biomechanics in physio, understand why we need to study biomechanics in exercise, why that's important, identify the difference between open chain exercises and closed chain exercises, referring to the kinetic chain. Identify how biomechanics can be used to aid either progression or regression, and be able to define the difference between a squat, a good morning, that's an exercise, not a greeting, and of course a deadlift. So these are the principles of exercise therapy. We've got adaptation, we've got specificity, we've got progression, regression, overload, reversibility, taking time out, behavioral change, individuality, lifestyle integration, the law of diminishing returns, and the fact that it's the patient's responsibility. You give that responsibility back to the patient. So biomechanics. It's the study of how human movement is going to be affected due to injury, could be dysfunction, could be muscle, could be joint, could be nerve, could be pain, could be congenital abnormalities. The list goes on, and we're trying to optimize this movement. So, for instance, if you're rehabilitating a young child with cerebral palsy, okay, they're not going to walk in the normal way that a child of that age would. Okay, we've got to try and optimize their movement with maybe some orthotics, okay, maybe some bracing, and we've got to work with what we have to the best of our ability as part of the rehab process. So biomechanics is divided into static biomechanics and then dynamic biomechanics, and we have two terminologies that you need to become familiar with. Kinetics, which is the causes of motion. An example of this is a ground reaction force, and then kinematics, which is the motion description, such as in meters or degrees. So biomechanics uses the laws of physics and engineering to describe motion undergone by various segments of the body and the forces that act upon these body parts during normal activities of daily living or indeed athletic performance. So we've got some principles of biomechanics. So the first principle is force motion. So how much force does it take to get something to move? The second is force time. How much time will be applied? How much force will be applied during that time? Inertia. This is the fact that an object will resist change in their state of motion. Range of motion, which will be linear or angular in terms of a joint. Balance and stability, which we've covered before, which is your center of mass over your base of support. The coordination continuum, so you've got optimal motor timing. Okay, this timing issue, very important. Segmental interaction, which is local joint isolation, and then the sum of all segments, which is either open or closed kinetic chain. So 8 biomechanical principles in total. So here we have an example here. So in quiet standing, you've got two forces really working, so gravity and ground reaction force, and your horizontal force is going to be minimal. So the two forces cancel each other out, keeping the person essentially motionless in the vertical direction. So forces must act before changes in motion can occur. I hope that makes sense. So that's quiet standing. So biomechanical principles. Okay, so stability. So the lower the center of gravity, or the larger the base of support, the closer the line of gravity to the center of the base of support, the greater the mass, the more stability increases. So maximum effort. So the production of maximum forces requires the use of all joints that can be used. The production of maximum velocity requires the use of joints in order from the largest to the smallest. Okay, so from proximal to distal. Linear motion, the greater the implied impulse, the greater the increase in velocity, and movement usually occurs in the direction opposite to that of the force being applied. Just imagine you're pushing something. Okay, angular motion is produced by the application of force acting at some distance from an axis or creating torque. So what do we mean by force? So force equals the mass of an object times its acceleration. So objects are reluctant to start moving from a static position, and they're reluctant to stop moving once in motion. The other important reaction force for you to understand is ground reaction force, particularly when walking. So there's two types of stability. We've got linear stability and rotatory stability that we describe here. Okay, but you've always got that static and dynamic. Static and dynamic. Okay, so when a person is at rest, their linear stability is proportional to the mass and the frictional forces between the person and the supporting surface. Okay, mostly the floor when you're standing. So dynamic, while a person's moving, linear stability is directly related to their momentum. Okay, the faster they're going, the more stable they are. The heavier the patient, the faster his movements, the greater the person's linear stability. Okay, so we've got rotatory forces. Okay, so resistance of being pushed over, and the resistance of rotating an object or person against a reduction in rate of spin. So remember that the lower the center of gravity, the larger the base of support, the closer the line of gravity to the center of the base of support, and the greater the mass, the more stability. So force and velocity, maximum force. In order for maximum force to be produced, it requires the use of as many joints as possible from the body. So maximum velocity is produced if it requires the use of joints from largest to smallest, from proximal to distal. Okay, leaving out one joint can reduce the overall effect of that force. Then we've got implied impulse. The greater the implied impulse, the greater the increase in velocity. Impulse equals force multiplied by time. Direction, movement occurs in the direction opposite to the applied force. Remember that pushing example is a good one. And then angular motion, and that's produced by application of a force acting at a distance from an axis by means of torque. And angular momentum increases the closer the force is to that axis. So the body as a biomechanical system. The bones can be thought as levers acted upon by muscles in order to move stuff. So we apply the principles of physics to determine how much strength is required by the muscles and how much force needs to act upon those joints. Okay, so the musculoskeletal machine works in three planes, works in the sagittal plane, dividing the body in left and right, works in the frontal plane, dividing the body between front and back, and works in the transverse plane, referring really to the spinal cord with regard to rotation. So open and closed chain exercises. So an open chain, that's where the distal segment is free to move. Imagine kicking a football or throwing a ball. These are examples of open chain exercises. Okay, but there can be a single joint, such as knee extension, and that's going to produce shear at the joint. And we want to really reduce the amount of shear that we have at joints, unless they're going to be specifically useful. So you might need to strengthen a muscle in isolation for the purposes of rehabilitation. Think about hamstrings strengthening after an ACL, or quad strengthening after an ACL rehabilitation program. And it's used in functional activities such as kicking and throwing. So now closed chain, this is where the distal segment is in contact with the supporting surface, normally the floor. So imagine like a squat or a lunge. So multiple joints are required and that requires the coordination of muscle activity, and that's going to include compressive forces rather than shearing forces, and compressive forces are normally healthier for the body. And the general functional movements: squatting, hip hinging, lunging, pushing, pulling, twisting, and gait. Okay, but think about the squat as a classic closed chain exercise. So the types of muscle contraction, we've got isometric, concentric, and eccentric, and you remember that by the acronym ICE. ISO means balancing or the same. Okay, so imagine yourself in mid-range, so the muscle's strongest in mid-range, and you're just resisting that isometric force. Okay, so concentric, if we're using the example of a bicep curl, it will be when we've got the weight in our hand and we're bringing the fist up towards our shoulder, and then as we lower down, that's going to be the eccentric phase as we lengthen under load. So concentric is the positive phase, the lifting phase. Eccentric is the lowering phase. Isometric is normally done in mid-range. So we've got a comparison between open chain and closed chain exercises there. And just remember that just because you've got multi-joint movement, such as kicking and throwing, doesn't mean that it's closed chain. It must be in terms of the support surface. Okay, so we're going to ask you which types of lever these are. Have you got it? Okay, so we've got the image on the right. The skull, that's a level 1 lever. We've got the image in the middle, okay, the calf raise, that's a level 2 lever. And we've got the image on the left, the bicep curl. And most levers within the body are level 3. Okay, this one included, the bicep curl being a level 3 lever. So how do we remember levers? So we've got the axis, the resistance, and the force. So a first class level lever, okay, the axis is going to be in the middle. Okay, so if we go back, you can see that the axis is on the middle, on the skull example. Okay, if we go to a second class lever, the R, okay, so the resistance is in the middle. Okay, you can clearly see the resistance on the middle in the calf raise. Okay, and third class lever, F, okay, the force is in the middle. Here you can see the force in the middle. Okay, and you remember that by ARF. Okay. Right, so levers will change according to the effort required during a movement. So you can see if we're looking at the hip to knee line, okay, that hip to knee ratio is where you can see that in standing, okay, the hip and knee are perfectly aligned, and then when you're doing a deep squat, okay, the hips and the knees are about as far apart as they could possibly be with the full length of the femur. Okay, some terminology. So the rotational center will be the fulcrum, the axis or the joint. The load will be the resistance, the weight, or the resistance force. Okay, the applied force will be the effort, and the lever arm or the moment arm or the force arm, okay, that's the length of what we're talking about. And there's Garfield helping us out. Thanks, Garfield. Okay, so here what we're doing is we're changing the lever arm. Okay, so that is a lateral raise on a long lever. Okay, you can see that the moment arm will change. So at the base of the movement, okay, there's no movement arm, and then when you laterally raise all the way out to the side, the moment arm is greater. So we're talking about changes of fulcrum. Here we've got some glute medius exercises there. Okay, and by doing some glute medius exercises with the knee bent, okay, we're halving the lever. Just on this one, we're halving the lever. Okay, if you were to do this with a straight leg, that would double the lever, increasing the moment arm, which will be increasing the effort. If we're relating that to a squat versus a deadlift, you can see that the moment arm of the hip in the deadlift is significant, whereas it's equal in the squat. And that's how you can remember the difference between a squat and a deadlift in terms of the moment arm of the knee and the hip. Yeah, so the squat's going to produce more work in the glutes and the quads, and the deadlift is going to produce more work in the glutes and the hamstrings, working that posterior chain for the deadlift. So in the squat, okay, it depends where you place the load, okay, but you roughly want an equal distance between the knees, the moment arm of the knee and the hip, okay, particularly on a back squat, okay. If you're changing it to a low bar back squat, that's going to change the effort, and if you're doing a front squat here, again, that's going to change the effort, but the moment arm, okay, should be roughly the same. So a good morning exercise is basically a deadlift, although this time the load is behind your back. Okay, so it's still working the glutes and the hamstrings, but the load is behind the back. Okay, and there'll be equal moment arm between, okay, the hip, okay, and here the back as well. So this exercise is basically like taking a bow, and that's a good morning. So here you can see how a squat can rapidly become a good morning if you're doing it with the wrong technique, looking at the lever arms. Okay, so there's the good morning here, and there's the back squat. Okay, so the load is the same, but the joint angles are different. So the deadlift. Here you can see that we've got a very small moment arm at the knee, and it's all about the hip moment arm. Huge hip moment arm here. Okay, as we work the glutes and the hamstrings on this movement. And it's just like picking something up off the floor. Now, if you've got short arms, that's going to change your angle, and if you've got longer arms, that's also going to change your angle of the torso. Just something to be aware of with the variety of patients. So by the end of this lecture, you should have a good understanding of biomechanics in physio. You should understand why it's important to study biomechanics, particularly with regard to levers. So the longer the lever, the greater the effort. We need to identify the difference between open chain and closed kinetic chain exercises. We've got to use biomechanics to either progress the exercise or regress the exercise, and you've got to know the difference between a squat, a good morning, and a deadlift. Okay, so if we go back up to these exercises, okay, so there's your squat versus the deadlift. There's your squat. There's your good morning. Make sure you know the differences between those two. Okay, thanks for listening, and we'll see you in the next podcast.